Have you ever wondered if your kidneys are trying to send you a warning without you even realizing it? What if I told you that your kidneys could be signaling that something's wrong, but you're missing all the signs? It's surprising, but medical experts have discovered 11 common symptoms that may point to serious kidney problems. In fact, about 37 million Americans have kidney disease, but 90% of them don't even know it. That's why kidney disease is often referred to as the hidden threat. You might feel healthy, but your body could be giving you urgent warnings right now. Studies show that by the time people notice something's wrong, they could have already lost up to 75% of their kidney function. In the next few minutes, I'll show you these 11 warning signs, and one of them is something that 82% of people experience every day without even realizing it's linked to kidney health. This video is for informational purposes only. It is not intended to diagnose or treat any medical conditions. Always consult a healthcare professional if you have concerns about your health. Fatigue and lack of energy. Imagine waking up in the morning after a full night's rest, yet still feeling like you haven't slept at all. That overwhelming tiredness that persists throughout the day, no matter how much you rest, is called fatigue. It's a common and often ignored sign of kidney disease, and many people don't realize how serious it can be. But here's the catch. It's not just about being tired after a long day at work or a workout. It's a deep, constant feeling of exhaustion that can take a toll on every part of your life. So, why does kidney disease lead to fatigue? Your kidneys play a key role in filtering waste and excess fluid from your blood. When they're not working properly, harmful toxins build up in your bloodstream. This toxic buildup is a major contributor to fatigue, but it doesn't stop there. As kidney function declines, your body might also develop anemia. Anemia occurs when your body doesn't have enough healthy red blood cells to carry oxygen to your muscles and tissues. This means less energy for everything you do, from walking to carrying out simple daily tasks. The result is that constant feeling of exhaustion that doesn't seem to go away. But there's more to it. Kidneys also produce a hormone called erythropoietin (EPO), which stimulates your bone marrow to produce red blood cells. If the kidneys aren't functioning properly, they might not produce enough EPO, leading to lower red blood cell count, further contributing to your fatigue. Without enough oxygen being delivered to your tissues, your body has to work harder to perform even simple tasks, leaving you feeling drained and sluggish. What to do? If fatigue is something you've been struggling with, especially if it doesn't improve with more rest, it could be a sign that your kidneys need attention. It's time to schedule a visit with your doctor. Ask for a blood test to check your kidney function, specifically for the levels of creatinine and glomerular filtration rate, GFR, which are key indicators of kidney health. A simple test can help reveal if there's any kidney-related issue that might be causing your fatigue. Also, be sure to pay attention to your hydration levels. Dehydration can exacerbate fatigue, so drink plenty of water throughout the day. But be cautious not to overdo it if you already have kidney problems. Balance is key. Iron-rich foods such as spinach, red meat, beans, and fortified cereals can help combat anemia. These foods can support the production of red blood cells and help bring energy back into your body. If necessary, your doctor might recommend iron supplements to further boost your red blood cell count. Remember, feeling constantly exhausted isn't normal, especially if you're getting enough sleep. Fatigue could be a warning sign that your kidneys are in distress, and catching it early can make all the difference in your treatment and overall well-being. Don't ignore it. Your body is trying to tell you something important. Swollen feet and ankles. Have you noticed your feet and ankles swelling up after a long day? It's a common issue, especially if you've been on your feet for extended periods. But what if this swelling isn't just from standing too long? What if it's a sign that your kidneys are struggling? Swelling, or edema, is a major symptom of kidney disease, and it happens when the kidneys are unable to regulate fluid balance properly. When your kidneys are healthy, they help maintain the right amount of fluid in your body by filtering out excess water and waste. However, when kidney function begins to decline, they lose their ability to remove this excess fluid efficiently. As a result, fluid begins to accumulate in the lower parts of your body, particularly in your feet, ankles, and legs. This is why you may notice that after a long day of activity or even after sitting for long periods, your feet and ankles appear puffy or swollen. Swelling can also occur around your face or hands, but it's most noticeable in the lower extremities due to gravity. For individuals with kidney problems, the accumulation of fluid isn't just a minor inconvenience. It's a clear indicator that your kidneys are having trouble doing their job. But that's not all. Swelling in the feet and ankles can also be linked to other complications, such as high blood pressure and protein leakage into the urine, both of which are common in kidney disease. When proteins leak into your urine, a condition called proteinuria, they cause an imbalance that allows fluid to escape into the tissues, leading to swelling. So, if your feet and ankles are consistently swollen, it might be time to pay attention to what's going on inside your body. What to do? If you're dealing with swollen feet and ankles, there are a few steps you could take to manage the symptoms, but it's important to address the root cause, potential kidney dysfunction. One of the most effective ways to help reduce swelling is by cutting back on salt in your diet. Excess sodium can make your body retain more fluid, worsening the swelling. Try to limit processed foods, which are often high in sodium, and opt for fresh fruits, vegetables, and lean proteins instead. At night, elevate your feet by propping them up with pillows while you rest. This helps the fluid drain back down from your legs to your upper body, reducing the buildup in your lower extremities. Compression socks are another option that can aid in reducing swelling by promoting better circulation. However, if the swelling persists or gets worse despite making these changes, it's crucial to consult a doctor. Swelling could be a sign of kidney damage, and your healthcare provider will want to assess your kidney function. They may run tests to measure your kidney's ability to filter waste, such as blood tests for creatinine levels or a urine test to check for protein. If kidney dysfunction is detected, early intervention can prevent further damage and improve your overall health. Don't ignore persistent swelling. While it might seem like a minor inconvenience, it could be a sign that your kidneys are in distress, and taking action early is key to protecting your health. Dry and itchy skin. Have you recently noticed that your skin feels more dry and itchy than usual? It could be more than just the weather. This might be a warning sign that your kidneys are in trouble. Healthy kidneys are responsible for filtering out waste and excess minerals from your blood, keeping things in balance. When your kidneys aren't functioning properly, however, toxins and minerals that would normally be filtered out start to build up in your bloodstream, affecting various systems in your body, including your skin. Kidney disease can cause a range of skin issues, but one of the most common is dryness and persistent itching. As the buildup of waste products, such as urea and creatinine, increases, it can lead to skin irritation and dryness. This often starts as an overall feeling of discomfort, but as the condition worsens, the skin can become cracked, scaly, or rough. The itching, also known as pruritus, can be intense, especially on the legs, arms, and back. This condition, often referred to as uremic pruritus, is caused by the accumulation of toxins and an imbalance in minerals, such as calcium and phosphate. The itching may be so severe that it disrupts your sleep or daily activities, making you uncomfortable and frustrated. In some cases, the skin might also develop patches of redness, rashes, or even bruising from scratching. Additionally, kidney dysfunction often results in a loss of vital nutrients that keep the skin healthy. This combination of toxic buildup and nutrient deficiencies makes it harder for your skin to retain moisture, leaving it dry and susceptible to irritation. The more the kidneys struggle to do their job, the more pronounced these skin issues can become. What to do? If you're dealing with dry and itchy skin, there are several steps you can take to provide some relief. Start by moisturizing your skin regularly with a gentle, fragrance-free lotion to help lock in moisture and prevent further drying. Look for products that are specifically designed for sensitive skin, as they are less likely to irritate or worsen the problem. Consider taking lukewarm, not hot, showers and avoid harsh soaps or scrubs that can strip your skin of its natural oils. Over-the-counter anti-itch creams, such as those containing hydrocortisone, may help reduce itching and inflammation, but they should be used sparingly and as directed. While moisturizing and skincare can offer temporary relief, if your dry skin and itching persist, it may be time to consult a doctor. Chronic dry skin could be a sign that your kidneys aren't functioning properly and that waste and toxins are accumulating in your body. Your doctor may recommend blood tests to check kidney function and look for signs of kidney disease. If kidney disease is diagnosed, Addressing it early can help reduce the impact it has on your skin and overall health. In some cases, your healthcare provider might also suggest dietary changes, medications to help balance minerals in your body, or specific treatments for itching related to kidney dysfunction. In addition to seeing a healthcare provider, consider consulting a dermatologist if the dry and itchy skin becomes unbearable. They can offer specialized skincare treatments and help manage symptoms related to kidney disease, ensuring your skin stays as comfortable and healthy as possible while addressing the underlying cause. If you've been experiencing dry, itchy skin along with other symptoms of kidney dysfunction, don't ignore it. It could be a crucial sign that your kidneys need immediate attention, and the sooner you take action, the better chance you have at improving your health and well-being. Shortness of breath. Have you ever felt short of breath after minimal exertion, or even when you're simply sitting still? While shortness of breath is commonly associated with exercise or physical activity, it can also be a silent symptom of something much more serious: kidney issues. The connection between the kidneys and breathing might not be immediately obvious, but when kidneys are compromised, they can cause fluid buildup in the lungs, making it harder to breathe. Fluid retention in the lungs. One of the key roles of the kidneys is to filter excess fluid from your body. When kidney function is impaired, your body's ability to regulate fluid balance becomes disrupted. As a result, fluid can accumulate in various areas, including the lungs, a condition known as pulmonary edema. This buildup in the lungs can create a feeling of tightness or heaviness in the chest, along with labored, shallow breathing. Even activities that usually don't leave you winded, like climbing stairs or walking around the house, can suddenly feel exhausting, leading to a sensation of shortness of breath. Anemia and oxygen supply. In addition to fluid buildup, kidney problems often lead to another issue that contributes to breathlessness: anemia. Healthy kidneys produce a hormone called erythropoietin, EPO, which signals the bone marrow to produce red blood cells. These red blood cells are responsible for carrying oxygen throughout your body. However, when the kidneys are damaged, their ability to produce EPO declines, leading to lower levels of red blood cells and, as a result, reduced oxygen supply to your tissues and organs. This lack of oxygen causes fatigue, weakness, and difficulty breathing, as your body struggles to perform essential tasks without adequate oxygen. Anemia is particularly concerning because it can worsen the effects of fluid retention and exacerbate your breathing difficulties. As your heart works harder to circulate the reduced number of red blood cells, it can lead to increased strain on the cardiovascular system, making shortness of breath even more pronounced. What to do? If you experience unexplained breathlessness or a noticeable change in your breathing patterns, it's essential to see a doctor right away. Shortness of breath, especially without exertion, should never be ignored. Your healthcare provider will likely perform a series of tests, including blood tests to check for anemia and kidney function, as well as imaging tests like a chest X-ray or an echocardiogram to assess the condition of your lungs and heart. While waiting to see your doctor, it's important to take measures to alleviate the discomfort. Elevating your head and chest while resting can help reduce the sensation of breathlessness caused by fluid buildup in the lungs. Avoiding strenuous physical activity is also crucial until the underlying cause of your shortness of breath is identified and addressed. If kidney disease is confirmed, your doctor will work with you to develop a treatment plan, which may include medications to manage fluid retention, treatments to address anemia, and strategies to improve kidney function. In more advanced stages of kidney disease, more intensive interventions like dialysis may be required to help remove excess fluid and waste from the body. By addressing shortness of breath early, you can improve your overall health and prevent further complications related to kidney dysfunction. Recognizing the connection between your breathing difficulties and kidney health is an essential step toward getting the help you need to breathe easier and live a healthier life. Muscle cramps. Muscle cramps, those sudden, sharp pains that can wake you up in the middle of the night or strike unexpectedly during the day, are something many of us experience from time to time. However, if you've noticed that these cramps are happening frequently or have become especially painful, it could be a sign that your kidneys need attention. Although muscle cramps are often associated with dehydration or overuse, frequent cramps could indicate an underlying issue, such as kidney dysfunction. Electrolyte imbalance and kidney function. Your kidneys are responsible for regulating a number of important electrolytes and minerals in your body, including potassium, calcium, and magnesium. These minerals are crucial for proper muscle function, including muscle contraction and relaxation. When your kidneys aren't working properly, they can't maintain the right balance of these electrolytes in your bloodstream. This disruption can lead to an imbalance, which in turn causes muscles to contract uncontrollably, leading to painful cramps, especially in the legs and feet. Kidney disease, particularly in its later stages, can cause a condition known as hyperkalemia, high potassium levels, or hypocalcemia, low calcium levels. Both of these imbalances can cause muscle spasms, cramps, and weakness. The imbalance of electrolytes affects the muscle's ability to contract and relax properly, making them more prone to cramping, especially during the night when the body is at rest. Why nighttime cramps? Nighttime muscle cramps, or nocturnal leg cramps, are a common complaint among people with kidney disease. As your body winds down for sleep, the muscles relax, but they may still become overstimulated due to the electrolyte imbalance. This leads to cramps that can be particularly severe and painful, often leaving you awake and restless at night. People with kidney disease may be more susceptible to these cramps because of the kidney's inability to properly filter out excess potassium or regulate calcium levels in the blood. In addition to electrolyte imbalance, poor circulation caused by kidney disease can contribute to muscle cramps, as decreased blood flow can result in a lack of oxygen and nutrients reaching your muscles, making them more likely to cramp. What to do? If you've noticed a sudden, unexplained loss of appetite, especially when it's accompanied by nausea or a feeling of fullness, it's important to pay attention to this symptom. While it might not always be kidney-related, persistent loss of appetite can indicate an underlying problem that requires medical evaluation. If these symptoms last more than a few days or worsen over time, it's time to schedule an appointment with a healthcare provider. What to do? If you're experiencing frequent muscle cramps, especially at night, it's essential to pay attention to this symptom and take proactive steps to address it. Here are some practical strategies that can help. Stay hydrated. Proper hydration is essential for maintaining electrolyte balance. Drink plenty of water throughout the day to help flush out toxins and keep your kidneys functioning at their best. However, if you're on a restricted fluid intake due to kidney disease, it's important to follow your doctor's advice on how much fluid you should consume. Stretching before bed. Gentle stretching exercises before bedtime can help reduce the frequency of cramps and keep muscles flexible. Try stretching your legs, calves, and feet for a few minutes each night to relax your muscles and reduce tension. Some people find that stretching helps prevent cramps from occurring while they sleep. Monitor your diet. Make sure you're getting enough of the key minerals that support muscle function, such as potassium and calcium. However, if you have kidney disease, it's important not to overdo potassium, as this can worsen kidney function. Talk to your doctor or dietitian to help you manage your mineral intake. Warm compress or massage. Applying heat to the affected muscles can help alleviate cramps. Use a heating pad or warm compress on your legs or feet if you experience cramps at night. A gentle massage can also help relax the muscle and improve circulation. Consult your healthcare provider. If your cramps are persistent, severe, or worsening over time, it's crucial to speak with a healthcare provider. They may recommend blood tests to check your electrolyte levels and kidney function. If the cramping is due to kidney disease, your doctor may suggest medications to help regulate your potassium or calcium levels. Additionally, they may recommend treatments such as dialysis or dietary changes to support your kidneys. By addressing the underlying electrolyte imbalance and taking steps to manage your hydration and diet, you can reduce the frequency and intensity of muscle cramps. However, if kidney disease is suspected, early intervention is key to managing the condition and preventing further complications. Always consult with your healthcare provider to ensure you're taking the appropriate steps for your health. Puffy eyes. Waking up with puffy eyes is a common experience for many of us, often attributed to a poor night's sleep, allergies, or too much salt in the diet. However, if you notice that the puffiness persists or worsens over time, it could be a sign of something more serious, kidney disease. Specifically, when your kidneys aren't functioning properly, they can allow protein to leak into your urine, leading to fluid buildup throughout your body. This fluid retention can cause swelling, especially around the eyes, which is often one of the first noticeable signs. The role of kidneys in protein regulation. Healthy kidneys are responsible for filtering waste and excess fluid from your blood while retaining important substances, such as protein. One of the most important proteins in the body is albumin, which helps maintain the right balance of fluid inside your blood vessels. If your kidneys are damaged or not functioning properly, they can begin to leak protein into the urine. This is a condition known as proteinuria, and it often occurs in the early stages of kidney disease. When protein leaks into the urine, it reduces the amount of albumin in the bloodstream. This causes fluid to accumulate in tissues, leading to swelling or edema. The swelling often starts in the areas where gravity has the most effect, such as the lower legs, feet, and around the eyes. Puffy eyes or periorbital edema are often one of the earliest and most noticeable signs of kidney-related fluid retention. Why the eyes? The skin around the eyes is particularly delicate and thin, making it more prone to showing signs of fluid retention. As a result, when fluid builds up in the body due to protein loss in the urine, the area around the eyes becomes the most noticeable. The puffiness may be more pronounced in the morning after lying down overnight, as gravity shifts and causes fluid to pool in the lower parts of the body. In addition to protein leakage, kidney disease can affect blood pressure and circulation, both of which contribute to the fluid retention that causes swelling. If kidney disease is left untreated, the protein loss and fluid retention can worsen, leading to more severe swelling and additional complications. What to do? If you're noticing persistent puffiness around your eyes, it's important to pay attention to other potential signs of kidney problems, such as changes in your urine, swelling in other areas of the body, or unexplained fatigue. Here are some practical steps to address the issue. Check for other symptoms. Foamy urine. If your urine appears frothy or foamy, it could indicate the presence of excess protein, which is a sign of kidney disease. Proteinuria is often one of the first indicators that the kidneys are struggling to filter waste properly. Leg swelling. Swelling in the legs, ankles, or feet can accompany the puffiness around the eyes. This is another key sign of fluid retention caused by kidney dysfunction. Changes in urination patterns. Pay attention to any changes in how frequently you urinate or the color of your urine. Dark, concentrated urine, or a reduction in urine output can be an indication that your kidneys aren't filtering fluids as they should. Reduce sodium intake. Excess sodium in the diet can exacerbate fluid retention and worsen swelling. Reducing your salt intake can help alleviate some of the fluid buildup around your eyes. Opt for fresh, whole foods and avoid processed foods, which are often high in sodium. Stay hydrated. While it may seem counterintuitive, staying properly hydrated is crucial for kidney health. Dehydration can lead to kidney strain and worsen fluid retention. Drinking enough water helps the kidneys filter out toxins and maintain proper fluid balance in the body. However, if you're on a fluid-restricted diet due to kidney disease, consult with your doctor to determine the right amount of water you should be consuming. Elevate your head at night. If you notice puffiness around your eyes in the morning, try sleeping with your head slightly elevated. This can help reduce the amount of fluid that pools around your eyes while you sleep. Consult a healthcare provider. If the puffiness around your eyes persists, especially if you notice other symptoms such as foamy urine, leg swelling, or changes in urination, it's time to consult a doctor. They may recommend blood and urine tests to evaluate your kidney function and check for proteinuria. An early diagnosis is crucial in managing kidney disease and preventing further damage to the kidneys. Monitor your blood pressure. High blood pressure is a common cause of kidney damage and can contribute to protein leakage in the urine. If you have high blood pressure, it's important to work with your healthcare provider to keep it under control. Lifestyle changes, such as eating a balanced diet, exercising, and managing stress, can help lower your blood pressure and support kidney health. Puffy eyes may seem like a minor cosmetic issue, but if it's accompanied by other signs of kidney problems, it could be a warning sign that your kidneys need attention. Kidney disease often progresses without noticeable symptoms until it reaches an advanced stage. By recognizing early signs like puffiness around the eyes, you can take proactive steps to address the issue and protect your kidney health. Don't hesitate to seek medical advice if you suspect kidney issues, as early intervention can significantly improve outcomes and prevent further complications. High blood pressure. Did you know that high blood pressure, hypertension, can be both a cause and a result of kidney problems? It's a bit of a vicious cycle where one issue feeds into the other, making it harder to manage both conditions. Understanding how high blood pressure affects kidney function and how kidney disease can influence blood pressure is essential for protecting both your heart and kidneys. How the kidneys regulate blood pressure. The kidneys are key players in regulating blood pressure. They help control the amount of fluid in the body by filtering out excess sodium, water, and waste. The kidneys also produce a hormone called renin, which plays a critical role in controlling blood pressure. When blood pressure is too low, the kidneys release renin to signal the blood vessels to constrict, which helps raise blood pressure. Conversely, when blood pressure is too high, the kidneys help eliminate extra fluid and sodium to bring it back to normal. However, if the kidneys become damaged or diseased, they may not function properly. This can cause them to retain excess sodium and fluid in the body, leading to an increase in blood pressure. When the kidneys are compromised, their ability to regulate blood pressure is diminished, contributing to the development of high blood pressure. High blood pressure as a cause of kidney damage. On the flip side, high blood pressure can also be a cause of kidney problems. Over time, high blood pressure can damage the small blood vessels in the kidneys, making it more difficult for the kidneys to filter waste properly. This damage can lead to kidney disease or worsen existing kidney problems, creating a cycle where the kidneys and blood pressure continuously affect each other. This is why high blood pressure is both a risk factor for kidney disease and a common complication of kidney problems. If blood pressure is not properly managed, it can lead to the progression of kidney damage and even kidney failure. What's at risk? When kidney function is impaired due to high blood pressure, the kidneys become less efficient at performing their many tasks such as removing waste products from the body, balancing fluid levels to prevent excess fluid buildup, regulating electrolyte levels such as sodium, potassium, and calcium, maintaining the balance of red blood cells, which is essential for oxygen delivery. Without proper blood pressure regulation, the kidneys may not perform these functions effectively, causing a cascade of health issues. This can result in dangerous complications, including kidney failure, heart disease, and stroke. What to do? If you're dealing with high blood pressure or kidney disease, or both, it's important to take proactive steps to manage both conditions. Here are some key strategies. Monitor your blood pressure regularly. The first step in managing blood pressure is knowing what it is. Regularly checking your blood pressure at home or during doctor visits helps you track any changes and allows you to take early action if needed. The American Heart Association recommends a blood pressure reading of less than 120/80 mmHg for healthy adults. If your readings are consistently higher, it's important to address them immediately. Adopt a kidney-friendly diet. One of the most effective ways to manage both kidney health and blood pressure is by adjusting your diet. A heart-healthy, kidney-friendly diet can make a significant difference in controlling blood pressure and reducing kidney strain. Here's what you should focus on. Limit sodium intake. Excess sodium can increase fluid retention and elevate blood pressure. Avoid processed foods, canned foods, and salty snacks. Eat potassium-rich foods. Potassium helps balance sodium levels and supports proper kidney function. Incorporate foods like bananas, oranges, spinach, and sweet potatoes into your diet. Focus on lean protein. Overconsumption of protein can strain the kidneys, especially in those with existing kidney issues. Aim for lean protein sources like chicken, fish, and plant-based options such as beans and legumes. Limit processed foods and sugars. These can contribute to high blood pressure and further strain your kidneys. Exercise regularly. Physical activity is one of the most effective ways to reduce high blood pressure. Regular exercise helps improve heart health, boost circulation, and promote healthy kidney function. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, swimming, cycling, or yoga are all great choices for supporting your cardiovascular and kidney health. Take medications as prescribed. For some individuals, medication may be necessary to manage high blood pressure or kidney disease. Doctors may prescribe medications like ACE inhibitors or ARBs, angiotensin receptor blockers, to help protect the kidneys from damage caused by high blood pressure. Diuretics, commonly known as water pills, may also be prescribed to help the kidneys eliminate excess fluid and lower blood pressure. Manage stress. Chronic stress can contribute to high blood pressure. Techniques such as mindfulness, meditation, deep breathing exercises, and yoga can help lower stress levels and, in turn, reduce blood pressure. Managing your stress can be just as important as physical health habits when it comes to maintaining balanced blood pressure. Get adequate sleep. Poor sleep quality or sleep apnea can raise blood pressure. Ensure that you get at least 7 to 8 hours of quality sleep each night. Address sleep issues like snoring or insomnia by consulting with your healthcare provider. Sleep hygiene practices such as sticking to a regular sleep schedule and creating a restful sleep environment can help. Consult with a doctor. If you're experiencing high blood pressure and suspect it might be related to kidney problems, it's crucial to seek medical advice. A healthcare provider can evaluate your kidney function through blood tests and urine analysis. These tests will help determine if kidney disease is contributing to your elevated blood pressure. Based on your results, your doctor will develop a tailored treatment plan to address both your blood pressure and kidney health. The bottom line: high blood pressure is both a cause and a result of kidney issues, making it essential to monitor and manage your blood pressure if you're at risk for kidney disease. By adopting healthy lifestyle changes, taking prescribed medications, and seeking regular medical care, you can break the cycle between high blood pressure and kidney disease. This proactive approach helps protect both your kidneys and your heart, ensuring a healthier, more vibrant future. Blood in the urine. Noticing blood in your urine can be a frightening experience, and understandably so. It's one of the most noticeable and concerning symptoms of kidney problems. While it may seem like a rare or extreme issue, the presence of blood in your urine is a clear sign that something could be wrong with your kidneys, and it should never be ignored. What causes blood in urine? When blood appears in your urine, it's referred to as hematuria. Hematuria can range from a faint pink or red tint to the urine to a more noticeable presence of blood. There are two types of hematuria. Microscopic hematuria. This means there are small amounts of blood in the urine that aren't visible to the naked eye. A doctor would detect it through a urine test. Gross hematuria. This occurs when the blood is visible in the urine, turning it a reddish or brown color. Several conditions may contribute to blood in the urine, and some of them are linked to kidney health. Kidney stones. Kidney stones are hard, crystalline mineral deposits that form in the kidneys. These stones can irritate the urinary tract and the kidneys, sometimes causing bleeding. If the stones move or obstruct the urinary tract, they may lead to pain, hematuria, and even infection. Urinary tract infection. UTI, infections that affect the urinary tract, including the bladder, urethra, or kidneys, can cause blood in the urine. Infections can also cause symptoms like painful urination, frequent urination, and fever. Kidney infections. Pyelonephritis, a severe kidney infection, can occur if bacteria travel up from the urinary tract to the kidneys. Infections of this kind often cause not only blood in the urine but also flank pain, fever, and chills. Glomerulonephritis. This refers to inflammation of the kidney's filtering units, glomeruli, often caused by an immune system issue or infection. Glomerulonephritis can cause microscopic or gross hematuria and may lead to kidney damage if left untreated. Bladder or kidney cancer. In some cases, blood in the urine can indicate more serious underlying conditions such as bladder or kidney cancer. Tumors in these organs can cause bleeding, though they often present without other symptoms in the early stages. Trauma or injury. Physical injury or trauma to the kidneys, such as from an accident or impact to the body, can also lead to bleeding in the urine. This can result in blood in the urine, along with pain and swelling in the abdomen or back. What's at risk? The main risk of untreated hematuria is the potential for kidney damage. Blood in the urine may signal underlying conditions that are damaging the kidneys, and without timely intervention, these problems could lead to further complications like kidney infections, permanent kidney damage, or kidney failure. Additionally, conditions like kidney stones, infections, and glomerulonephritis can worsen over time, leading to more severe and difficult-to-treat health issues. What to do? If you notice blood in your urine, the most important step is to seek medical attention immediately. Do not try to wait it out or self-diagnose. Here's what you should do. See a doctor or visit the emergency room. Blood in your urine warrants immediate attention, especially if the blood is visible or if you're experiencing other symptoms like pain, fever, or difficulty urinating. A healthcare provider will perform a detailed evaluation to determine the cause of the bleeding. Early detection can lead to more effective treatment and better outcomes. Urine and blood tests. A doctor will likely order a urine test, urinalysis, to check for the presence of blood, infection, or other abnormalities. They may also conduct blood tests to evaluate kidney function and check for signs of infection, inflammation, or other issues that could be affecting the kidneys. Imaging tests. If necessary, imaging tests like ultrasound, CT scans, or X-rays may be used to get a clear view of the kidneys, bladder, and urinary tract. These tests can help detect kidney stones, tumors, or blockages that may be causing the bleeding. Further evaluation. If a more serious condition like glomerulonephritis, kidney infection, or bladder/kidney cancer is suspected, the doctor may recommend further evaluation through kidney biopsy, cystoscopy, a procedure to look inside the bladder, or other diagnostic procedures to pinpoint the exact cause. Follow the treatment plan. Once the underlying cause of the blood in the urine is identified, your doctor will recommend an appropriate treatment plan. Depending on the diagnosis, this could include antibiotics for treating infections, UTIs or kidney infections, pain management and hydration for kidney stones, surgery or procedures for removing kidney stones, tumors, or treating blockages. Medications to manage inflammation, like corticosteroids or immunosuppressive drugs if the cause is glomerulonephritis. Cancer treatments such as surgery, chemotherapy, or radiation for more serious conditions like kidney or bladder cancer. Lifestyle changes and prevention. Preventing kidney issues in the future is crucial for maintaining kidney health. Here are some steps you can take. Stay hydrated. Drinking plenty of water helps prevent kidney stones and supports kidney function. Maintain a healthy diet. Eat foods that are good for kidney health, such as fruits, vegetables, and lean proteins, while limiting salt and processed foods. Control chronic conditions. If you have conditions like high blood pressure or diabetes, make sure they're well managed to protect your kidneys. Regular checkups. If you have a history of kidney problems or risk factors like hypertension, regularly check your kidney function through urine and blood tests. The bottom line, blood in the urine is a sign that something is wrong with your kidneys or urinary system, and it should never be ignored. It's important to act quickly by seeking medical help and following through with any tests and treatments your doctor recommends. Early diagnosis and intervention can help prevent further complications, protect kidney function, and ultimately improve your quality of life. If you notice blood in your urine, don't hesitate. Take action to safeguard your health and your kidneys. Frequent or reduced urination. Your urinary habits can reveal a lot about your overall health, and sudden changes in how often you urinate, the appearance of your urine, or the effort it takes to go to the bathroom can be red flags for kidney issues. The kidneys play a crucial role in filtering waste and excess fluids from your body, which then get excreted through urine. When kidney function is compromised, it can directly affect your urinary system, leading to noticeable changes in urination. What changes might you notice? Increased frequency of urination. Polyuria. If you find yourself urinating much more frequently than usual, especially during the night, a condition known as nocturia, it could be a sign that your kidneys are struggling to concentrate urine. Normally, the kidneys concentrate urine to conserve water, but when they're damaged, they might produce more diluted urine, leading to frequent trips to the bathroom. This could be caused by conditions like diabetic nephropathy or chronic kidney disease. Urinary retention, oliguria or anuria on the other hand. If you're having trouble urinating or feel like you can't empty your bladder completely, this could indicate oliguria, low urine output, or anuria, very little or no urine output. Kidney dysfunction can make it difficult for the kidneys to filter and excrete waste, leading to reduced urine output. Urinary retention can also be a symptom of blockages, like kidney stones or prostate problems in men. Changes in urine color. Healthy urine is typically pale yellow, but kidney problems can cause changes in its color. Dark or amber urine can indicate dehydration, but if the kidneys aren't filtering properly, waste buildup can also lead to darker urine. Red or pink urine could be a sign of blood in the urine, hematuria, which may suggest kidney stones, urinary tract infections, or kidney damage. Foamy urine is often a sign of proteinuria, where the kidneys are leaking excess protein into the urine. This is a common sign of kidney disease and can be an early indicator of kidney dysfunction. Pain or difficulty urinating. If you experience pain, burning, or discomfort while urinating, this could indicate a urinary tract infection, UTI, or a kidney infection, both of which can affect kidney function if left untreated. Additionally, kidney stones or a blockage in the urinary tract can cause sharp pain, especially during urination. Foamy or frothy urine. Foam in your urine might be more noticeable when you urinate into the toilet, especially if it forms a persistent layer of bubbles. This could be a sign of proteinuria, excess protein in the urine, which occurs when the kidneys are damaged and can no longer filter protein efficiently. The foam is formed by the proteins in the urine, and this is a common early warning sign of kidney disease. Why are changes in urination a concern? When your kidneys aren't functioning properly, they struggle to filter out waste and excess fluids from your blood. This leads to an imbalance in fluid levels, toxins accumulating in your bloodstream, and potentially harmful changes to your urine. If left untreated, this can cause severe complications, including kidney failure. What to do? If you notice changes in your urination habits, it's important to take them seriously and take action as soon as possible. Here's what you should do. Track your urination patterns. Keep a detailed record of changes in your urination habits. Note how often you go to the bathroom, any discomfort or pain you experience, and any changes in the appearance of your urine. This will provide your healthcare provider with helpful information to make a diagnosis. Stay hydrated. Drink plenty of water throughout the day, but if you're noticing increased urination, make sure you're not overhydrating. Similarly, if you're having trouble urinating or notice your urine is very dark, ensure you're drinking enough fluids. Balance is key. Consult with a doctor. If you experience any of the following, seek medical attention promptly. Increased or decreased frequency of urination. Painful urination. Foamy, dark, or discolored urine. Difficulty urinating or the sensation of not being able to empty your bladder completely. Swelling, especially around the ankles or legs, as this can be associated with fluid retention caused by kidney dysfunction. Your doctor will likely perform urinalysis to check for signs of infection, blood, or protein in the urine. They may also recommend blood tests to assess kidney function, including measuring your creatinine levels and glomerular filtration rate, GFR. Urine tests. Urinalysis. This test will examine the color, clarity, and chemical composition of your urine. It can detect protein, blood, and other abnormalities that signal kidney problems. 24-hour urine collection. This may be ordered to assess kidney function over a full day and to measure things like protein levels and kidney filtration efficiency. Imaging tests. If the doctor suspects something more serious, they may recommend imaging tests such as ultrasound, CT scans, or X-rays to get a better look at the kidneys, bladder, and urinary tract. These tests can identify blockages, kidney stones, or other issues that might be affecting urine flow. Early treatment and prevention. The sooner you address urinary changes, the better. If kidney disease or dysfunction is diagnosed early, there are treatments and lifestyle changes that can help manage the condition and prevent further damage. This includes managing underlying health conditions like high blood pressure or diabetes, staying hydrated, maintaining a kidney-friendly diet, and taking medications as prescribed. The bottom line: changes in your urination habits, such as frequent urination, difficulty urinating, changes in urine color, or foamy urine, can be early indicators of kidney dysfunction. These signs should not be ignored, as early detection can significantly improve treatment outcomes and prevent serious complications. If you notice any changes in your urinary patterns, it's crucial to consult a healthcare provider as soon as possible for a thorough evaluation. Protect your kidneys by staying informed and taking action early to safeguard your health. Bubbly or foamy urine. While seeing bubbles or foam in your urine might not immediately raise alarm bells, it can be a significant warning sign of kidney issues, particularly proteinuria, the presence of excess protein in the urine. Healthy kidneys are designed to filter waste products and excess fluid from the blood while retaining essential substances like proteins. When the kidneys are damaged or not functioning properly, they may allow proteins, such as albumin, to leak into the urine. This leakage can cause the urine to appear foamy or bubbly, which can be one of the early signs of kidney damage or disease. What causes foamy urine? 1. Protein leakage. Proteinuria. The primary cause of foamy urine is the leakage of protein into the urine. When the kidneys are healthy, they filter out waste and fluids while keeping important proteins, such as albumin, in the bloodstream. However, damaged kidneys lose this ability, allowing proteins to pass into the urine. The excess protein causes foam or bubbles when you urinate, particularly when the urine is forcefully expelled into the toilet. The foam can be more noticeable if the urine is concentrated, dark yellow or amber, or if the kidneys are experiencing more significant damage. Proteinuria is often one of the first signs of kidney disease and can be associated with conditions such as chronic kidney disease, CKD, glomerulonephritis, inflammation of the kidney's filtering units, diabetic nephropathy, kidney damage due to diabetes, hypertensive nephropathy, kidney damage due to high blood pressure. 2. Urinary tract infections, UTIs, or kidney infections. While less common, UTIs or kidney infections can sometimes cause foamy urine. These infections can cause inflammation in the urinary tract and kidneys, which might lead to changes in urine appearance. However, the foam caused by infections is usually accompanied by other symptoms like burning during urination, fever, or pain in the lower back or abdomen. 3. Dehydration. In some cases, dehydration can cause concentrated urine that might appear foamy, but this is typically temporary and not caused by protein leakage. Dehydration causes the kidneys to retain water, concentrating waste in the urine, which can create bubbles or foam. However, this foam tends to dissipate quickly and doesn't persist as it would in cases of proteinuria. Why does protein cause foam? Proteins like albumin, which are present in blood plasma, are larger molecules than other waste substances filtered by the kidneys. When these proteins leak into the urine, they have a tendency to create bubbles due to their molecular structure and surface tension. The foam can be more pronounced if there is a large amount of protein in the urine, or if the urine is released forcefully. What to do if you notice foamy urine? Track your symptoms. Consistency. Pay attention to whether the foam is a one-time occurrence or if it happens consistently. One-off instances of foamy urine might be linked to temporary factors like dehydration. However, if it persists over several days, it may point to an underlying issue that needs attention. Other symptoms. Note any other symptoms you might experience alongside foamy urine, such as swelling in your feet or ankles, fatigue, changes in urination frequency, or back pain. These symptoms combined with foamy urine could signal kidney dysfunction. Stay hydrated. If dehydration is the suspected cause, make sure you're drinking enough water throughout the day. Proper hydration helps dilute the urine and can reduce the appearance of bubbles or foam. However, this won't address the underlying issue if it's due to kidney damage. Consult a healthcare provider. Urinalysis. The first step your healthcare provider will likely take is a urinalysis. This test checks for the presence of excess protein, proteinuria, blood, or other abnormalities in your urine. It will help determine if protein leakage is occurring and whether kidney function is compromised. Blood tests. A blood test, including measurements of creatinine and glomerular filtration rate, GFR, will help assess how well your kidneys are filtering waste from your bloodstream. If kidney function is impaired, these values will be abnormal. 24-hour urine collection. In some cases, a doctor may ask you to collect all of your urine over a 24-hour period to accurately measure the amount of protein being excreted. This helps provide a clearer picture of kidney function. Monitor blood pressure. High blood pressure is both a cause and a consequence of kidney disease. If you're experiencing foamy urine, it's a good idea to monitor your blood pressure regularly. High blood pressure can worsen kidney function, and treating hypertension early is key to preventing kidney damage. Kidney ultrasound, or imaging. If a urine test indicates significant protein loss, or if there are other concerning symptoms, your doctor may recommend an ultrasound or other imaging tests to evaluate the health of your kidneys. These tests can help detect kidney stones, tumors, or other structural problems that might be affecting kidney function. Lifestyle changes and medication. If kidney disease is diagnosed, your doctor may recommend certain lifestyle changes to protect your kidney health, such as adopting a kidney-friendly diet, limiting salt intake, and increasing physical activity. Medications may be prescribed to lower protein levels in the urine and manage blood pressure, both of which can slow the progression of kidney disease. Address underlying health conditions. Diabetes and high blood pressure. If you have diabetes or high blood pressure, controlling these conditions is crucial to protecting your kidneys. Proper management can prevent further kidney damage and reduce protein leakage in the urine. Avoid over-the-counter medications that can harm kidneys. Certain over-the-counter medications, especially NSAIDs, non-steroidal anti-inflammatory drugs, can worsen kidney function over time. Always check with a healthcare provider before taking any medication, especially if you have a history of kidney issues. Foamy urine is often a sign of proteinuria, a condition linked to kidney dysfunction. If you notice persistent foam or bubbles in your urine, don't ignore it. Seek medical advice to assess kidney function and identify any underlying health issues. Early detection of kidney disease can help prevent long-term damage and preserve your overall health. Your kidneys are silent workers, filtering waste and toxins from your blood to keep you healthy. But if they're struggling, your body will send out signals to warn you. Recognizing these signs early is key to preventing irreversible damage. If you're experiencing any of these symptoms, it's crucial to act fast and see a healthcare provider. Early detection can significantly improve outcomes and protect your health. Remember, don't ignore the warning signs. Your kidneys might be trying to tell you something very important. Thanks for watching. If you found this video helpful, make sure to like, share, and subscribe for more tips on keeping your body healthy. Hit the bell icon for updates on future videos.